Good afternoon, everyone, and welcome to our COVID press briefing, the weekly briefing that we do every Thursday. I'm proud to be here at Worcester State University. And just start like I always do. Remember to wear your mask, socially distance, wash your hands, practice good hygiene over the next several months even. So it's the most important things you can do, as Dr. Hirsch has told us, and Mr. Manager has told us every week. And I am pleased to be joined here today by City Manager Ed Augustus, Dr. Michael Hirsch, President Barry Maloney from Worcester State University, Carolyn Jackson, CEO of St. Vincent's Hospital, and Lisa Colombo, Executive Vice Chancellor for the Commonwealth of Medicine of UMass Medical School. Today, it's a wonderful occasion. It's a happy occasion. We're going to be in the Wellness Center at Worcester State University. Will be the mass vaccination site for the City of Worcester starting on February 16th. The manager and the other speakers will be getting into more details of the hours and who is eligible, but more than anything, I want to urge everyone to be patient. We've waited a long time to get vaccinated. I've heard from people who are desperate for the vaccine. Everyone who wants the vaccine will be getting the vaccine, but we need to make sure that our seniors and our most vulnerable populations are served first. On the statewide level, the governor said he expects 120,000 new appointments over the course of this week. Next week, 30 more pharmacies across the state are expected to come online as vaccine dispensary sites offering 21,000 more appointments. Some of the sites are coming online, like those in Mattapan and Roxbury, will be serving just residents of Boston before transitioning to receiving everyone. Other sites like Gillette Stadium or here at Worcester State University will host people from anywhere across the Commonwealth of Massachusetts. This is a complicated situation as the state works to vaccinate the most vulnerable population first. Again, we just ask you to be informed, be patient, and please go to the state vaccination website at mass.gov to find an appointment. The state and the city is working to set up a call center for those who are not comfortable using the internet. Ultimately, the number of sites is important, but we need to recognize that we're only as effective as the number of vaccines that we receive. As that supply chain increases, you'll see more sites opening, more appointments, and longer hours of operation. If the Johnson & Johnson vaccine is approved and eventually distributed, it will allow for greater efficiency because it's more stable and can be stored at any room temperature. So there's a lot of reason for hope. We know that every vaccine that is distributed reduces the likelihood of new cases. Yesterday, there were 97,000 new cases on the national level of COVID-19. The last time we saw less than 100,000 new daily national cases was November 3rd of 2020. Statewide, we had a good week, and no single day reporting more than 2,700 new daily cases, whereas a few weeks ago, we were averaging over 4,000. Hopefully, we're at the beginning of a long and slow decline in the new cases and new fatalities. Be patient, remain vigilant. Even as the vaccine rolls out, please continue to practice good hygiene, wear your mask, and please don't gather in large groups, even as you watch the Super Bowl. I'd like to now turn it over to the City Manager. Thank you.
Thank you, Mr. Mayor. It's very exciting to be able to announce today the mass vaccination site here at Worcester State University. Vaccinations will be administered here starting Tuesday, February 16th. The facility will open 5 days a week, Tuesday through Saturday, 9 a.m. to 5:30 p.m. We will start with 1,000 vaccinations per day over the first several weeks, hopefully working our way up to 2,000 plus per day based on the supply of vaccines made available by the Commonwealth of Massachusetts. This took tireless planning and coordination of many people, and I want to thank our partners, Worcester State University, for hosting this site, St. Vincent Hospital, which will be running the vaccination operation here, and UMass Medical School, particularly the Commonwealth Medicine Division, part of the UMass Medical School, for helping provide all of the logistical support, the many students and other volunteers that will be necessary to make this facility function. These are some of the benefits. the very tangible benefits of being in a city like Worcester with all of these great institutions of higher learning. Over and over again, when I talk to developers, I always say my first paragraph or two, I'm bragging on the fact that we have 9 colleges and universities here and the talent that is sent out into the world from those institutions. And that's one of the ways that we have created this Worcester Renaissance that people talk about, is because of our colleges and universities, but also in a time of need. They are always there for us, whether it be making facilities like this available, or in the case of Commonwealth Medicine, rallying all those allied health students across the various campuses, training them, scheduling them, and making them available to our great partners like St. Vincent, who will oversee the operations here. This really is critical to us meeting the very strong demand and need that we have in the community, not only at this phase, the 75 and above, which we have all heard that there's great demand and anxiousness to access vaccination sites, and quite frankly, to access those sites that are convenient to them. Many of our seniors are trying to get appointments at Gillette or Fenway or other areas that are really a challenge in winter with transportation challenges. Having this right here in the middle of the city of Worcester, right in the middle of central Massachusetts, is going to be a great benefit and a great convenience and a great relief, I think, to our seniors and to their families who've been very anxious about how to access the vaccine. So thank you to all of our partners for being there, stepping up, and helping us bring this to fruition. This wellness center is the perfect location. Obviously, it's an amazing, just a few-year-old facility that will help accommodate the many thousands of people who will cycle through here through each eligible phase. As we go on from the 75 and above and go to the 65 and above and go to the folks with 2 or more complex medical conditions, that funnel will expand. And then when we get to the essential workers category, there will be so many more people who are looking to access that and ultimately on to the general availability. So as each of these new sites come online, it opens up that funnel, it opens up the availability, and that really is what we're all about. And as was mentioned by the mayor, we're hoping to see some of the pharmacies come online as well in the next few weeks. And every one of those just adds to our capacity to meet the strong demand. I also want to mention that we are now actively working with our partners with the Worcester Housing Authority, as well as the housing authorities in the alliance towns that the city provides the public health services for, as well as some of the private elderly housing sites throughout the city. We know just in the city of Worcester there are more than 10,000 units of senior housing. Many of those units have more than one person living in them. So that represents 12, 15,000 seniors who live in these buildings. And we are working with them now to try to identify locations to bring on-site clinics to those folks, hopefully toward the end of this month, the beginning of March. That's important because it'll take pressure off locations like this and allow folks who may have mobility issues and transportation issues to know that they'll be able to get the vaccine right in their own building. And so we are working aggressively on setting up that schedule and that rollout. I've asked Dr. Castile, our Commissioner of Health and Human Services, to work on that. We also are reaching out, working with some of our other local senior service agencies to put together a plan to reach out to folks who are homebound, our seniors who are homebound, who don't live in a congregate setting. They may live in their own home or in an apartment in a 2 or 3 family home, but don't have the easy ability to get out and get to a site like this, won't have a site necessarily in the building they live in. We want to figure out how to get out to them and get them the vaccine. It's a fairly complex challenge because we know folks need to be observed for 15 minutes after the vaccination is given. There are a lot of challenges with transporting the vaccine, particularly if you're going to individual homes. So there's a lot of details with that. I know Commonwealth Medicine has graciously, once again, stepped up and offered to work with us on that plan, as well as the site. So we'll have all of our assets here in the community, making sure that no one is left behind when it comes to accessing this vaccine. Let me just give you an update on the cases. As of today, since the beginning of the pandemic, Worcester has had 19,321 confirmed positive cases of the coronavirus here in the city of Worcester. That's an increase of 492 cases from last week. You notice that is a very steep decline from last week's numbers, almost half of what we reported last week's numbers. So I think it's clear that we have plateaued and hopefully now begun the decline in the number of new cases. This surge and the decline that we're now seeing, hopefully a consistent trend, is the result of the fallout of Thanksgiving and Christmas and New Year's and the travel and the gatherings that were related to those events, and then the corresponding delayed impact of the spread of the virus to other folks, the testing, catching up with that, and the numbers that we saw over the last couple of months. So it really is critically important that we learn from those lessons as we go into Super Bowl weekend. We know the instinct on Super Bowl weekend is to gather with family and friends, to enjoy the game, to enjoy the company of those that we love, but we know that's not the right thing to do this year. So we urge folks not to make the mistakes that clearly were made around Thanksgiving, around Christmas, around New Year's, that exacerbated the surge that we experienced. We don't want to see that repeated around the Super Bowl weekend this weekend. So we're urging folks, stay in your immediate family, enjoy the game, use Zoom and other ways to stay connected with family and friends, but don't gather outside your bubble. Certainly don't let your guard down with your mask and the other protocols that we remind people week after week. And we won't see another spike in the weeks following this Super Bowl weekend. I would remind folks that we will have a full team of inspectors out this weekend. I know in normal times our bars and our restaurants would be very crowded, our social clubs would be very crowded with people hosting Super Bowl parties at those locations and enjoying food. This is not the year for that. And we will have a full team out making sure that everybody is complying with the governor's orders around gathering sizes and all of the social distancing requirements. Let me give you the numbers for the towns. Shrewsbury had another 77 cases this week, bringing their total to 2,321. Holden, another 66 cases, bringing their total to 1,165. And Grafton, another 29 cases, bringing their total to 911. The combined UMass and St. Vincent numbers, COVID-positive inpatients, 288. That's a decline of 20 from last week. COVID-positive ICU patients, 44. That's down 4 from last week. Tragically, in the last week, another 26 individuals passed away due to the coronavirus between the two health systems, and 27 health workers tested positive for the coronavirus. If you look at that number, that is significantly down from where it had been. So hopefully between the overall slowing of the spread in the community and the fact that large percentage of health workers have now had the opportunity to get both doses of the vaccine, we should see those numbers hopefully continue to come down. In the city of Worcester, there were 15 additional deaths, bringing the total number of Worcester residents who've been lost to the virus to 382. DCU Field Hospital, there are currently 39 patients in the DCU Field Hospital. Among city employees, we have 6 active cases of COVID-19 with those employees isolating per the protocols. 4 additional folks who are quarantined, close exposures. So that's a total of 10 employees that are out between isolation and quarantine. Over the past several weeks, the city has had our vaccination clinics, our EDS sites, emergency distribution sites at the senior center. Typically, we do those Monday, Tuesday, and Wednesday of the week. This week, we are doing them tomorrow, Friday, and Saturday. We have several hundred folks booked in for those appointments, and we expect to fully utilize our allotment of vaccine over those 2 days. Remind people that you can go on mass.gov to book your appointment. They have created a wait list option. My understanding is there's more than 1,500 local folks on that wait list now, anxious to get the vaccine. And again, that's why these sites are going to be so helpful, so people don't have to wait too much longer or go too far to get that vaccine. This coming week, our Monday, Tuesday, Wednesday clinics will be the first round of second doses at the senior center. So the first responders and the other categories of folks identified in step 1 of phase 1 will now be coming in for it was a Moderna vaccine, so they're coming in 28 days after the first dose, and they'll start getting their second doses at those first 3 clinics. And then we will run clinics for rounds of first doses at the end of next week at the senior center. So far, we've given out more than 3,100 vaccines at the senior center site. I'm proud to say that amongst our Worcester first responders, 77.4% of the Worcester Police Department have been vaccinated, and 78.4% of the Worcester Fire Department have been vaccinated. So those are getting into the numbers that Dr. Hirsch has talked about, that Dr. Fauci and others have recommended to get that herd immunity, and we're going to continue to try to drive those numbers even further. Our Alliance towns, 59 first responders in Grafton, 78 in Shrewsbury, 24 in Holden, 10 in West Boylston, and 56 in Millbury. And just finally, we have been committed from the beginning of this virus to try to do all we can to have these press conferences to share in as close to real time as possible the latest developments, the latest information folks should know, need to know to deal with this and protect themselves and their family and our community. I want to specifically thank our local media partners who allowed us to have town hall meetings, some combination of Dr. Hirsch, myself, Dr. Castile, and Karen Clark, our medical director, in the last couple of weeks have been on WCRN, La Mega, the Telegram and Gazette, WTAG, and Mass Live. So thank you to all of them for helping us get the word out and answering your readers, viewers, or listeners' questions and our residents' questions. I also want to let folks know that we continue to do outreach. This Sunday, February 7th, we will be doing a town hall meeting virtually with the African clergy. On February 9th, we'll be doing it with U Inc., one of our large social service providers. On Wednesday, February 10th, we'll be doing it with Worcester State's own Latino Education Institute and Accentria. So again, we are trying to reach into the community, particularly parts of our community that we know may have some hesitancy to accessing the vaccine, talk to them with language services and accurate, helpful information to try to get them to make the decision to get the vaccine and know and make an informed choice for themselves and their families. With that, I want to turn it over to our partner and our good friend, Carolyn Jackson, the CEO of St. Vincent Hospital.
Thank you, Manager Augustus. This week marks 1 year since COVID came to the U.S. Most of us have been impacted since March, and it's been a long time to go through this, but it seems much, much longer. However, we've made great progress. We've made progress as to how we protect ourselves. We've made progress with testing, and we've made progress with how we provide care for COVID-positive patients. Now it's time to make more progress with vaccinations. At St. Vincent, we've put together a great vaccination process for our staff, our physicians, and other healthcare workers within the Worcester community. And we're really excited to expand that expertise, helping as the clinical lead at this great vaccination site here at Worcester State University. We've already vaccinated approximately 3,000 people at St. Vincent, and now combining our expertise along with that of Commonwealth Medicine and Worcester State, we'll be vaccinating thousands more. As the clinical partner for the City of Worcester's vaccine clinic, St. Vincent Hospital will be providing daily clinical oversight as well as operational leadership at the site. In addition, numerous members of our staff, as well as our medical staff, as well as Commonwealth Medicine's volunteer corps, will be manning the clinic and providing everything from check-in services, drawing up the vaccines, actually vaccinating people, and getting people checked out and on their way back home. We're so excited for this opportunity to help contribute to the path towards the end of this pandemic, which is something we're all looking forward to. I want to thank all of my colleagues at the city, UMass Medical School, Commonwealth Medicine, and Worcester State University for allowing St. Vincent Hospital to have this great opportunity. The COVID vaccine is here, but we cannot relax in our diligence to prevent the spread of COVID-19. I want to stress the importance of continuing to social distance, keep wearing your mask, and perform frequent hand hygiene. We need to do our part to continue keeping ourselves safe, as well as our community and our loved ones. And now, I'd like to turn it over to Lisa Colombo, the Executive Vice Chancellor for Commonwealth Medicine.
Thanks, Carolyn. I am the short one on the panel, so good afternoon, everyone. As Carolyn said, I'm Lisa Colombo. I'm the Executive Vice Chancellor for Commonwealth Medicine, which is the Consulting and Operations Division of UMass Medical School. I'd like to thank our city leadership and our partners here today, as well as the leaders of the state's Executive Office of Health and Human Services for their support and collaboration as we've planned this mass vaccination site. UMass Medical School and Commonwealth Medicine are providing two essential functions to support this operation. We echo the importance of this vaccination site to accommodate and accelerate the vaccination of people across the state and especially here in central Massachusetts. As I said, our role is twofold. First, we'll be providing logistics support and project management, and in partnership with our colleagues at UMass Medical School, we're also supporting staffing with volunteers. You may know that hundreds of UMass Medical School nursing, medical, and graduate students have volunteered to support fair and equitable distribution of vaccines statewide. For several weeks, our students have been supporting our community in collaboration with Commissioner Maddie Castile and Dr. Michael Hirsch, both giving vaccinations to our first responders at the Senior Center and participating in outreach efforts to inoculate vulnerable populations across our region. These almost 500 student volunteers, in essence, form the nucleus of the Vaccine Corps, which has been formed to support this unprecedented public health effort to inoculate residents across the state. I'd like to acknowledge the Chancellor of UMass Medical School, Dr. Michael Collins, for bringing forth this idea and for his unwavering support and leadership. Through this, the Vaccine Corps and UMass Medical School students will volunteer at this mass vaccination site once it's up and running next week. Our overall goal for the Vaccine Corps is to continue to recruit students and other volunteers from across the Commonwealth to be able to support this and other efforts to distribute the vaccine. My colleagues at Commonwealth Medicine have created an online portal where anyone can volunteer to work at vaccination sites. To get to the portal, you can visit the Commonwealth Medicine webpage at commed, that's commed.umassmed.edu. We invite you to log on and register to help if you're so inclined. It's certainly our hope that the Vaccine Corps concept will continue to expand to meet the needs of the Commonwealth. And with that, I'd like to introduce the President of Worcester State University, Barry Maloney.
Good afternoon, everyone, and welcome to Worcester State University. On behalf of the faculty, staff, and students here at the university, we're glad to have everyone here on campus. Thank you, Lisa, for that introduction, and I want to point out that Dr. Colombo is also a WSU alum, so we're very, very proud of her and her accomplishments professionally. You know, when the Commonwealth began to reach out and to put out feelers and form thoughts about vaccine sites throughout the Commonwealth, I raised my hand and said, Worcester State University would like to be considered. I think it connects with the university's mission and purpose, a university that has been solving problems here in the greater Worcester area for almost 150 years. I'm also very proud to represent the HECMA schools here in the city, the colleges and universities here in the city of Worcester. As Carolyn said, that we've been working at COVID now for about a year, and together as a group, we have been working together to make sure that the infection rate in the city of Worcester has not been increased by the college students, faculty, and staff that live and work here. And I'm proud to say that the numbers bear that out. So I'm very, very proud to represent my colleagues here in the city. One of the reasons, for those of you who know Worcester State, one of the reasons that we were able to host this vaccination clinic and even have the conversation was because of this beautiful 101,000 square foot facility that opened in 2016. For those who remember Worcester State before this building was built, we would have been lucky to get a good poker game together in this court. But now we have a facility that is modern, that is ADA compliant, that has all the amenities necessary to help this community. When we were putting together the proposals to build this particular building and help us get support from the state for funding this project, this community stood with us and said this is an important project for the university and an important project for the city. And in part, this is why I am so steadfastly focused on trying to offer this facility to help our community, to help our neighbors. And keep in mind that the students that attend the university are local students, primarily from Worcester and Worcester County, so we are helping our community by helping our students, faculty, and staff as well. I would be remiss if I didn't also thank my partners, the City of Worcester, St. Vincent's, Commonwealth Medicine, the medical school, who the university has had a long-standing relationship beyond just this vaccination site. They help us run our health service department on campus. I certainly want to give a plug to all of the Worcester State University employees, Mike McKenna, Dr. Linda Larrabee, Carl Herron, and several others, Stacy Luster, a prominent leader here in the city of Worcester, who've had an impact on putting together the work that will result in starting off just a few weeks from now. I would also like to close with this. Lisa highlighted the core that is being built of volunteers. I'm proud to say that our nursing program, in my opinion, the best nursing program in all of the Commonwealth, is playing a role. Our nursing students, our faculty, and even our nursing alums are going to be pitching in and helping to vaccinate our residents, our neighbors, and our friends. So very, very pleased that you're all here, and I'm pleased to offer this facility to the vaccination site for our community. Thank you so much. It is now my distinct pleasure to introduce someone who has been instrumental in helping to guide not only the higher ed community, but all of us here in the city, Dr. Michael Hirsch.
Thank you, Dr. Maloney, and thanks to all our partners today. This is a really terrific feel and a great kind of vibe that we have today going on, because the partnerships that have been developed didn't happen overnight. The Worcester District Medical Society is also one of our partners, and they've volunteered a whole bunch of doctors, both retired and some still active, who have reactivated their licenses to help with the vaccination process that's going to be going on here. Back in 2009, when the big budget crunch came and the Department of Public Health was kind of reduced from close to 100 FTEs down to 4, the then city manager, Mike O'Brien, commissioned a think tank to figure out how we could reconstitute it. And a very important plank in the reconstitution was developing the Academic Health Collaborative, which allowed the Department of Public Health to interface with HECMA, the Higher Education Commission of Central Massachusetts, and let us kind of come up with projects that would be useful in the education of the students in our institutions of higher learning. So all of those building blocks have come into play in order for us to be able to tap into this wonderful facility, and we're really thrilled that this is going to be standing up and putting needles in arms, which is really, I think, something that we've heard loud and clear from the public. The more the needles in arms we can do, the better. Just this past Monday, we trained another 60 medical students up at the Senior Center with the help of Jill Terrian of the Graduate School of Nursing. And just to augment what Lisa Colombo said, I think we now, between the Graduate Nursing School and the med students, we have 650 people trained to be vaccinators. So a huge army to tap into. And I'm just probably a buck private, not really the leader of that, but I'm glad to see that they're going to be out there storming the beaches and helping us put these needles in arms in great numbers. They're so enthusiastic, and they just make me proud every day that they're part of the city of Worcester. The news this week has generally been great. As you heard from the city manager, our numbers have really decreased. And just to give you an idea about that, Dr. Ellison, the chief of infectious disease at UMass, told us that Tuesday was the very first day since May that there were no new employees that had gotten infected with COVID. So I think that that's an indication that the vaccination process is working. It's really, really cut down on the number of spreadable disease in our hospital setting. And our workers are staying healthier, and that's going to make them much more available for people that do unfortunately still have to wait to get the vaccination. We're also very excited that Dr. Ellison is going to be standing up a lab that's going to be trying to keep track of these variant strains you may have been hearing about. So far, we have not seen very many episodes of variant strains, only 2 cases as of Wednesday. Reported in the central Massachusetts area, and they were both fellow family members. If we don't see those variant strains take off, and if people follow the city manager and the mayor's advice about Super Bowl parties, I think we'll continue to see the virus kind of diminish as we get more needles in arms. Some of that's limited by the supply, as you've heard, but that supply is going to be cranked up, and I think that, you know, come the end of February, we will be humming at several places in Worcester and accommodating a lot of the needs for central Massachusetts as a whole. So I'm very excited about that, and I think that everyone who's behind me here really deserves a great debt of gratitude for their contributions and their willingness to step up. The only thing I will say is that, you know, the 3 W's are still very important. We start out with that admonition every week with the mayor's recommendation, and I will end with it too, because we still have a 5% chance with the Moderna and Pfizer vaccine that you could catch a case of COVID. We also have not worked out the question as to whether or not you could be a silent carrier of COVID. The initial news on that is pretty good, but it has not been formally worked out enough for us to feel like no one has to walk around with a mask. And what we don't want to see is a bunch of vaccination parties where everybody, once they get the vaccine, starts to throw the masks away and have these big group gatherings, because that will, I think, defeat the purpose of the vaccination process. So everyone needs to be patient in waiting for getting the vaccine, and patient to kind of get to the new normal, which we will once we have that herd immunity number, and we're going to get there. And thanks to all the people on the podium here. It's going to come a lot faster than people realize. So thanks very much.
Thanks, Doc. And before we open up the questions, I want to recognize our Chair of Public Safety of the Worcester City Council, Kate Toomey, who's behind here, and also City Council Sarah Rivera, who called, who couldn't be here, but wanted to thank our partners in person. She couldn't be, but she says, thank you very much, and working together, we will get through this. As Dr. Hirsch said, be patient. We've done this for 10 months, almost 11 months now together, and we'll get through this together. Thank you. Any questions?
The city manager touched on this, but how important is it when you have Fenway and Gillette and Springfield to get something online here in Worcester?
It's absolutely critical, especially when we're in the phase that we're talking about 75 and above. We know those folks, many of them have mobility issues, transportation issues. They're concerned about leaving their home or going too far away given the prevalence of COVID in the community. So it really is an important thing so those folks have easy access to the vaccine.
You said 1,000 a day to start with. Do you have some guarantees that you'll have enough vaccine?
Well, we're certainly hopeful. The Commonwealth has suggested that as the pipeline continues to grow, these sites are the places that they want to make sure get access to the vaccine because they're going to be some of the bigger funnels to get the shots in the arms, particularly to this category of folks. So we're fairly hopeful that we're going to be able to get the sufficient vaccines necessary.
And I take it you'll need an appointment. How do people?
So I don't know if Dr. Jackson wants to talk about that. We're kind of, sure.
So people will be able to sign up for appointments on the state website as they are at the other sites, and there'll also be a link to that on the St. Vincent Hospital website.
We've also heard a lot about confusion. You mentioned a call bank for people who are trying to figure out how to navigate that.
So at this point, we do not have a call bank, but there has been discussions of a more local call bank. I'm not sure if would you like to?
Yeah, are we talking about the number the governor's talked about to make?
I just think that when we talk about these mass sites and we have people all of a sudden interested in signing up in Worcester, if it's anything like we've seen at Fenway and Gillette, there's going to be some confusion as well as these people try and navigate the site. What do you guys have maybe prepared or maybe thinking about to help people in Worcester as they try and navigate to get here to sign up for a vaccine?
Yeah, so what we've been doing on a smaller scale with our site, our EDS site at the senior center, we've been proactively calling out to seniors, letting them know about the availability of that particular location. So events like this and our other channels to get the word out through the senior centers, senior serving organizations to let folks know when this is coming online, how to navigate it. And it is our hope that by the 16th or even before the 16th, that the state call line will be available to folks. So seniors or their family members who are trying to book in an appointment for their loved one would have that method available to them as well as the online portal.
Sorry, I have one more question for you. Well, you've seen at Fenway and Gillette also a lot of excitement. What is your message to people who are like, okay, we have something in Worcester. I take it you don't want people just to show up here.
No, you're going to need an appointment to come to this site, the same as the senior center. This is not drop-by. That's not safe from a COVID point of view. That's one of the reasons that we do appointments, to make sure that we have the right number of people in the locations and we can keep people distant and we don't overflow the facility. So you have to make those appointments. Sign up for the wait list if you can't get the appointment where and when you want it. Because as we've talked before, often at the end of the day, some people don't show up for their appointments, and there's some number of vaccines that might be available at the end of the day that need to be used within a particular point in time. If you're on that wait list, we want to be able to call folks in. Might be short notice, but if they can get down here, they might be able to get the vaccine sooner than they thought. So it really is important to use that system, but do not show up here because you won't be able to get the vaccine.
Everybody all set then? Thank you, everyone. Oh, Steve, go ahead.
I just had a question about equity. I covered a few meetings in the past week, public health and the Board of Health on Monday. They talked a lot about these studies that they've done through the health equity, the COVID-19 task force in the city that basically came to the conclusion that if you really want to get bang for your buck vaccinating in the city of Worcester, you should be looking at Hispanic people from age 30 to 59. and that's the, by and large, most impacted community in the city. And there was another outgrowth of that discussion that had identified neighborhoods where the virus has hit the hardest. University Park was the winner, the winner or loser. Union Hill, Vernon Hill, those kind of areas. Just curious, there was a sense of that the vaccine should be brought to those neighborhoods. And here we are at Worcester State, which is about as west side as you can get. And I know there's probably logistical, concerns and ADA and all that. But was there any other sense during the search for a site of bringing it more towards those communities of color that you've spoken about in the past year, that they would be in the priority list, but that seems to have melted away as we've talked about the seniors, and just wondering if you could talk about that a little bit.
Sure. Well, first, I'd suggest the first site that was open was on Vernon Hill, which is another highly impacted neighborhood at the senior center. One of the things that led us to this site is the physical layout, the accessibility, the parking. All of those needed to be part of consideration. I'd also reference back to what I said, that we are going on the road with the Worcester Housing Authority and other congregate senior locations that will do just what you're talking about, Steve. They'll go to Addison Apartments. They will go to Greenwood Village. They will go to 1050 and 1060 Main Street at Webster Square. They will go to those locations and bring the vaccine to a very diverse population who are in this particular phase, the 75 and above. Some of the folks behind me, we were on a Zoom call. As we get into subsequent phases, like essential workers, that's another opportunity, which might be a little bit more flexible than the 75 and above, to figure out how to go further into the neighborhoods, into locations where there are large concentrations of essential workers, whether they be at a box store, whether they be at a supermarket, where you've got a lot of workers who are in those locations, who maybe because of the hours they work don't have easy access to come to a site. We are trying to figure out how do we go to them. But those are subsequent phases. Again, we are doing the best we can to put these sites up, to get enough vaccines from the federal and state government to actually service these sites, as well as trying to plan for subsequent phases as they come online, which are going to be inclusive of a lot more of those kind of going into the neighborhoods and the harder hit areas. But again, we're trying to build this plane and fly it at the same time, and so it is not something that's lost on any of us. That's something that it's important for us to do, and we are planning to try to do it.
And, just a small follow-up on something that the mayor said about that this site, this vaccination site, is going to be open to the entire state, or anybody, anybody across the state, as these other mass vaccination state sites are. So there's not going to be any sort of, with the clamor that we have in the city, 180,000 people that would love a vaccine today. We're going to be competing with people who are just from out of our area that are looking for an appointment, or is there going to be a prioritization within that, or is it first come, first served?
Well, again, ultimately, the system is being expanded every day with new sites coming on. And just like there are Worcester people who made their way to Gillette and to Fenway and got an opportunity to get the vaccine, there might be people who are from Auburn or from Winchendon or from Fitchburg or from further away in Massachusetts who will be able to come here and get the vaccine. Maybe they work here and they live someplace else and they'll get the vaccine here. Ultimately, there should be enough availability that it doesn't have to be such a scramble to get access. And that's what we're all working on, trying to expand the options. When the pharmacies start coming online, that is going to provide a whole lot of options for folks that might be in their neighborhood, closer to where they work, closer to other places that they go. So over time, it's not going to be so much about, well, this is my location. It really is a system, and Worcester folks have been able to take advantage of the sites that were already open, and this site, because it's sponsored by the state's providing the vaccine, needs to be open to anybody in the Commonwealth.
So I guess my question is, when this train is up and running at full speed, how many vaccinations per day are we looking at? I heard anywhere from 2,000 to 3,000. Is that what we're expecting or you're expecting? And do you believe there'll be enough vaccine to day over day hit those numbers, especially as the pool of folks who needs a vaccine will grow as we move through the phases?
So our first week, when we start on February 16th, we'll be doing 1,000 vaccines a day, and we have every indication that we will be able to secure enough vaccine to make that happen. And we intend to ramp up as quickly as possible to 2,000 vaccines a day, and we really need to determine as we go through what the maximum number is in this room. We've done some mathematical models, but until you're actually running it, you need to kind of see what's going to work best. So 2,000 is our initial goal, get there as quickly as we can, and then see how high we can go from there. And we do have an indication that the state is prioritizing mass vaccination sites, so we do anticipate by being able to hit those high numbers that we should be able to secure sufficient vaccine.
This question is probably for the city manager. Today, the governor had announced he's going to increase businesses from 25% capacity to 40% capacity. A lot of time you have followed the state's recommendations, but what do you see Worcester kind of doing with that? Do you see them getting to the 40% or remaining at 25?
I'll be honest with you, Mike, I was having trouble hearing that last part of the question.
No, do you envision the city following that up to 40%, or are you going to stay at 25?
No, we're going to follow the state guidelines, and we are, as I mentioned earlier, going to make sure that we have enforcement teams out to make sure that people are staying within those guidelines. And again, we've talked about this quite a bit over the months. We are trying to strike that balance. Certainly public health and public safety is number one, but we also know that a lot of people rely on the jobs and the business that are related to the restaurants and the other facilities that are really struggling. So hopefully with these additional numbers, but people staying vigilant to those numbers and the protocols and the mask wearing and all of that. And as we're bringing the numbers down of disease in the overall community, those things will allow us to expand the capability, give a lifeline to our businesses, but not see huge spikes in the transmission of the disease.
And do we know which vaccine will be administered here?
So at least our initial orders will be Pfizer. We believe it will be exclusively Pfizer because of the large numbers, and Pfizer comes in trays of 975 doses. It could switch to Moderna at some point, but again, initially it will be all Pfizer.
Thank you, everyone. We'll see you next week. The mayor and I are going to do a one-on-one now, so if you want to stay.